you feeling today?
Very nice.
My name's Katie. I'm going to be your nurse today. This is Nursing Assessment, Advanced Assessment 3066C for Edison State College. My name is Katie Rueb, and I will be your nurse today. This is Hannah R. Can you tell me your birth date?
10/15/96.
10/15/96. We always have two identifiers to identify the patient. And our cameraman is Nathan Rueb, my son, and he will be joining us today behind the scenes. Okay, so can you tell me what you're in the hospital today for?
Rib pain right here.
Rib pain. Okay, I'm going to do a complete head-to-toe assessment for you, and we'll try to avoid that area as much as possible. I will have to assess that area, but I'll try not to push on it or anything like that. Okay? Can you tell me what day it is today?
Wednesday.
Wednesday. And who's President of the United States?
Obama.
Okay, and why are you here?
Rib pain.
Okay, and where are you?
Edison College.
Okay, in the simulation lab. Okay, first thing I'm going to do is just look at her general overall appearance. She's clean. She has her hair is well kept. She has clean clothes and just her overall appearance. Okay, she's well nourished. She is a 16-year-old female in the hospital today for left lower rib pain or unknown cause. Okay. First thing I'm going to do is look at her face and her overall appearance. Is everything symmetrical? I'm going to check for any lesions, bumps, abrasions, any pain, tenderness, and swallow for me. Swallow, okay. And smile. Okay, great. And can you smell? I'm going to I have some of this little. Okay, can you tell me what type of smell that is?
Clean.
Clean? Okay, clean is good. Okay, we're just checking olfactory cranial nerve. So I'd like you to frown for me, and furrow your brow, and raise your eyebrows. Great. And do lateral for the eyes, and up and down. What I'm looking for is any deviation in the eyes, or making sure that they're symmetrical. Okay. I'm going to check your eyes also with the pen light. And if my helper could turn off the lights for me.
Righto, Nurse Rueb.
Thank you. Okay, I'm looking for the pupils to be equal and reactive to light. I'm going to go ahead and shield your eyes. And they are equal and reactive to light. Okay, looking at my pen light, can you follow with your head? I'd like you to actually move your head, just move your head to the right, okay, and to the left, and center. Now without moving your head, just move your eyes lateral. And those are both normal. Okay, great. Can you lift your head up for me like this and turn down all the way to the side? Okay, and again, tilt to the side. We're checking range of motion for the neck and the head. Any problems with that? I'm going to take your hand here, and we're going to check an Allen's test. I'm going to have you close your fist, okay, and I'm going to include the the radial nerve, and open your hand. I'm not occluding it very well. There we go. And there should be pallor, and it should be returned back within 7 seconds, and then I'll do the ulnar side, ulnar and radial. Okay, I'm going to take a radial pulse while I'm here. Okay, and I've checked that for a full minute, and it is 93. We've already pre-done the vital signs. Her blood pressure on her right arm is 98/58. And her left arm we have not done on purpose because she had immunizations yesterday, and that left arm is very sore. Otherwise, we would compare the two sides. I'm going to go ahead and check your pulse, your radial pulse against your apical pulse. Okay, I'm just going to have you hold your breath if you could for me. Okay, good. I'm listening for lub-dub, S1 and S2. There are no extra clicks, murmurs, no extra adventitious sounds to her heart that I can hear. Okay, while I have you there, can I go ahead and loosen your gown here? I'm just gonna check your breathing and your lung fields and your heart. Okay. Okay, again, I'm looking for symmetry of the chest. Oh, you okay? Okay. Looking for symmetry of your chest. Looking to see if any pulses, especially for the upper carotids. I'm checking for any jugular vein distension, and there is none noted on either side. And then I'm checking, the carotid pulses, and of course you check one side and then the other, and they are equal bilateral. No bounding pulses, no bruits. Let me just hear that. No, no bruits noted on the other side. Okay, I'm going to listen to the aortic and pulmonic, the PMI, the mitral, and the tricuspid, both with the diaphragm and with the bell. The diaphragm should have high-pitched noises, and the bell should have low-pitched, kind of dull noises. Both are normal. Okay, I'm going to go ahead and we can put your nail back up there. Okay. Let's look into your eyes. We're looking for the symmetry. Aren't they beautiful? Yes. Looking for symmetry. Can you tell me if you wear glasses, contacts? No? Okay. Normal vision, 20/20. Okay. I'd like you to go ahead and read the little tiny fine print right there for me.
Sterility guaranteed unless package is damaged or open.
Okay. Now cover one eye and read it again.
Sterility guaranteed unless package is damaged or open.
Great. Okay, and then cover the other eye and read it backwards.
Open or damaged is package unless guaranteed sterility.
Great. And if there were any abnormalities, we of course would follow up with further eye examinations. Okay. We're going to check the ears and looking for any issues with the ears. We're looking for symmetry first of all. Are they both the same? Okay. Okay. And do they the top of the ear with the eye socket? That's where they should lie. And I'm pulling up on the pinning of the ear. Does that hurt? No? Okay. And then the mandibular joint. Go ahead and swallow for me. Good. Open your mouth. Ah. And close. No clicks or anything noted there. Okay. We are going to then look at a little bit deeper here. I'm going to press on your tummy, but again, I'll try to avoid that left side. Let's go ahead and lay you down.
Lay me down.
What's your pain level today, Hannah?
Only about 4 maybe.
4? Scale of 1 to 10. We've assessed pain level again as the 5th vital sign. Okay, we're going to go ahead and lift it. Just exposing what we need to here. Okay, we're going to listen to your aortic pulse. I'm looking for any bruises or any abnormalities to the skin. She is warm, pink, and dry, and I noted that to begin with when I first looked at her. I'll listen to the aortic pulse. Excuse me, aortic. Okay, and the 2 renals. You're gurgling all over the place. And positive breath sounds, or excuse me, bowel sounds. We're going to look at the iliac. Listen for the iliac. And then the femoral artery. May I check your femoral artery just on the inside of your thigh here? I'm just gonna press here. Okay, positive. Okay, no bulges or pain when I'm touching on that. Okay, we're going to listen to your bowel sounds. Good. Right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Okay. One of the things I'm going to do is press on your tummy, and you tell me if something hurts. But it's going to be deep palpation, so you're going to feel pressure, but shouldn't hurt. Okay. I'm going to have you take a deep breath in, and as you blow it out, I'm going to push it. Ready? 1, 2, 3, go. Okay. And I can also percuss, and I should hear the dullness over the liver. And it should change, and it does. Okay, the liver, and then again in and then out. Now, I should not be able to feel the spleen. If it is, it would be enlarged, and you want to stop because that could rupture. Appendix also the same. You should not be able to feel that appendix. Should not be ruptured or painful. We're looking for rebound tenderness with that appendix right there. Okay. Put that down. Okay. Are you comfy? Okay. One of the things we're going to look for in the legs. Okay. Okay. Go ahead and raise both feet off the bed for me. Good. Okay. Now hold them down. Good. Okay. I'm going to lift up this leg, and I'm going to have you push against, push, okay, and pull towards you, pull it towards you, good. I'm going to do range of motion, and we're going to abduct it, and then adduct it across the center line. And does it hurt in this hip joint at all? Okay, we're going to look for Homan sign. Go ahead and push against, pull it, there we go. Is there any pain in the bottom of your calf? No DVT. Okay, and then of course we do the same for the other side. Again, lift up, push against, pull up. And we're going to abduct the leg and adduct the leg and go over the side, checking for that hip joint. No issue. Holman sign, lift up and press again. Okay, I'll do Babinski's as well. And if her toes would fan out, then that would be an ominous sign. Okay, Hannah, what I'm going to have you do is go ahead and sit on the side of the bed for me. This side? Yeah, this side. Okay, and while she's sitting up, this is the easiest way to listen to lung feels. I'm going to go ahead and listen to all 9 lung fields. Starting up at the top, I should hear bronchular over the bronchus. And then I should hear vesicular over all of the lung fields. And big breath in and out, and in and out. Listen, of course, to all those intercostal spaces. Okay, and then we'll listen to the lateral lung fields. Okay, and they are all clear. Listening to the front of her lung fields as well. The front of her lung fields as well. The front of her lung fields as well.
Oh, the front. Aha.
Okay. Okay, we'll listen for the carotids, no bruits. Okay. And I should hear bronchular over the trachea, and then vesicular over the lung fields. And she does have breast tissue, so we go underneath the breast. I'm sorry, is that cold? Okay. And to the side. Okay, and then the PMI, point of maximal, where I should be able to hear the S1, S2 clearly. Okay, good.
And the cameraman forgot to turn back on the lights.
That's okay. That's okay. I got the lights. Alrighty. Okay, go ahead and we're going to do a little bit of range of motion. Okay. Go ahead and put your arms out straight for me and do a curl and down. Good. Against resistance, pull up, pull, good, push. Okay. And then how about your wrists? Can you move your wrists around? Good. And around in circles, very good. Okay, and holding together like this and turning them backwards like this. Do you feel any numbness or tingling there? Okay, good. And opening your fingers, closing them. Great. Okay, go ahead and stand up for me. And we're okay. Okay. I want you to do, take your foot and put your heel to your toe and walk across the floor. Try to keep, try to look up if you can. If you're looking for any dizziness, swallowiness. She shouldn't have any. Okay. And bend back. That's okay. Okay, that's good. Go ahead and stand on one foot with your up with your right, and then again with your left. Okay, it's all right. Let's try it again. Up with your right, and again with your left. Okay. Go ahead and close your eyes. I want you to stand with your arms out to the side. Close your eyes and take your right hand and take this finger and touch your nose. Good. And then your left hand and touch your nose. Good. Okay. And put your hands down to your side. Go ahead and sit back down for me. Okay, let's look at that rib cage here. You can. You want to lay down? I'm just going to look at that area that she's complaining of. And I don't see any difference in color. I don't see anything noted. I don't see any swelling. I don't see any protrusions. I'm a little nervous about touching it, but is there any pain right there? Does it hurt to push that area? No? Okay. All right. Okay, let me sign the Zinsky. All right, we're going to let Hannah take a break. She's going to go to the bathroom, and we'll be right back.